PIH profile. PIH means pregnancy-induced hypertension. For a patient having pregnancy-induced hypertension is called PIH. PIH means after 20 weeks of pregnancy, when hypertension occurs in a previously normal blood pressure patient. Women having a previously normal blood pressure, but after 20 weeks of pregnancy, we find that blood pressure is elevated significantly, then it is called pregnancy-induced hypertension. It may be that the pre-existing hypertension or gestational hypertension and pre-eclampsia, or pre-existing hypertension plus superimposed gestational hypertension with proteinuria, or hypertension that is unclassified. The symptoms persists are increased blood pressure, protein in the urine, the weight gain, the edema or swelling, some visual changes such as the double vision or blurred vision. Patient may have nausea and vomiting or urinating problems, the small amounts of urines are passing. So what is PIH profile? PIH profile means we have to blood test, pathological test for a patient having pregnancy-induced hypertension. So what are the tests that requires are PT-INR. PT means prothrombin time, international normalized ratio. So PT, prothrombin time, then complete blood count, CBC, then LFT or liver function test, and serum urea, serum creatinine, serum sodium, serum potassium, LDH, serum uric acid, and other is RBS, resting blood sugar. So for PT-INR, we have already told that PT-INR, we have to collect the blood and then pour the blood through this vial. This sky or light blue vial. We have to draw the blood from the vein, venipuncture, then pour the injection syringe through it and push the blood through it and filled up to this mark. So this is for PT-INR. And then for CBC or complete blood count, for we have to hemoglobin count or others, we have to use the purple or EDTA vial. And for liver function tests and serum urea and creatinine, K+, Na+, LDH, serum uric acid, we have to use for the clot vial. Clot vials means blood will be clotted as there is no anticoagulant. And then the RBS, resting blood sugar, the gray vial is used. Gray vial is used for glucose estimation, whatever blood test, resting or postprandial or fasting. So, but the PIH profile, we have to test the 4 tests, that is on is PT-INR and CBC, complete blood count, and this LFT, serum urea, serum creatinine, K+, Na+, LDH, serum uric acid. This all, so 1, 2, 3, 4, 5, 6 or tests will be together in red vial. We have to collect the blood and put the blood through this marks. The blood less is required with respect to this PT-INR or sky vial. Sky vial is have to fill. This has to fill up to this marks. But in the other vials, we have to fill up to this marks. So we have to, these 4 tests are used for PIH profile or PIH patient. We have to find any abnormality in the PT or CBC or LFT and RBC. So these 4 tests are done for a PIH patients having PIH, pregnancy-induced hypertension. So we will meet in another video. If this video is helpful, share it with your friends and subscribe this video, that the video you will get every day.